you so much, Anshik.
Thank you, Anshik, for the warm welcome and the great introduction. So, good evening, all. As you all know, I am a clinical nutritionist from TGHC, and today Jennifer is with us. She'll be speaking about smoking, mood, and anxiety. First of all, I would like to welcome you all to this space on behalf of the Good Health Clinic, where we will get an insight into how smoking can affect our mental health and mood, and what steps we can take to quit smoking with Ms. Jennifer today. So, as we all know, Ms. Jennifer is a practicing psychologist. So I believe she is the best person who can tell us how to do that. And, we must be knowing the people around us who are some or the other way indulged in smoking, right? And risking their health because of perceived momentary pleasure. So let's take the most out of this webinar and help our loved ones too. So thank you, Jennifer, for finding out the time and joining us.
Thank you so much. Thank you.
Okay.
Thank you, Pooja.
So you can start sharing your presentation and then we'll start with the webinar.
Sure. Just going to take a minute. Can you see my slide, Pooja?
Yeah. Okay. So first of all, I would like to introduce the Good Health Clinic to you all. We are an international team of specialist doctors, health coaches, and mind health counselors providing personalized, safe, and science-led health coaching. We specialize in helping people in reversing metabolic health conditions such as diabetes, hypertension, cardiac health, weight management, mental health, and women's health. The program is entirely online, and therefore we can provide best-in-class service to all our members affordably. So moving on to the webinar, please stay till the end because we have some good offers for you. And if you have any questions during the webinar, please type them into the chat box. I will bring them up during the Q&A session for the Jennifer. So from here, Jennifer, over to you.
Thank you. Thank you so much. All right. It's exciting to see so many of you all actually taking out time on a Wednesday evening to actually show up for such a session. So I would encourage you all so that we could make good use of this time. If you all can keep your cameras on, it'll be nice to interact with you all rather than just seeing names. It'll be nice to see you all and actually talk to you all. If you all have any doubts during this session, please leave it on the chat box if you have something to say or comment. But if you have something to share, you could raise your hand and probably we could chat about that. Yeah, let's keep this as an interactive session. I do not want to keep talking about things that we already could know. If you look at the topic, it's just smoking, anxiety, and mood. We probably know people who are smoking, or we could be engaging or actually smoking. And when we talk about smoking, or every time we hear about smoking, even in these movies and all of that, what we see is smoking is injurious to health. That is there. We know that it is affecting our physical health, and no one's negating it. We've seen so many research, so many studies on it already. But today, I think we should take time to actually discuss about how smoking can affect a person's mood. Some of us may say, I smoke, or when we talk to people who smoke, they would say, I smoke actually to help me stay in a sane mood. Otherwise, I'd get so irritated, I would get so angry. But today in our session, what we're going to try and understand is how smoking actually works with mood. Does smoking actually help you feel better? Does it actually help you relax? Does it help you focus? Because these are things that you hear people say. So we're just going to explore if are they actually connected, or is it just a myth? We're also going to look at smoking and anxiety. Anxiety is a real thing. It's not something that we're just talking about and, because of social media. It's not just an Instagram thing, right? Anxiety, people are actually feeling anxious, getting panic attacks, and they would resort to smoking because it helps them feel more calm. But again, just seeing how if anxiety and smoking are connected. So I'm not a doctor. I am not a health practitioner, would have very limited knowledge on that area. But what I can actually share with you all is about smoking and psychological health, about how smoking is connected to how the mind works. So that's what we're going to be focused on. right? And I think this was already asked, but I'm just going to, probably for the rest of you all who weren't here, if you all knew, the 31st of May, which was yesterday, was World No Tobacco Day. This is not that they are not going to sell tobacco anywhere. It was just to say that it is a day where we are going to inform others, just have an awareness about tobacco, just spread awareness about the dangers of tobacco, how it is affecting people's health, how it is affecting people's well-being and all of that, right? And how tobacco business is actually causing a lot of harm also to the environment, right? Not just to us as human beings, but also to the environment. So it's just one day that is taken aside to mainly celebrate or inform people about the dangers of tobacco. So this is exactly why we're having and choosing to have the session today.
True, Jennifer. We all know that, people around us somehow, get indulged into smoking, mostly because of, that momentary pleasure that they get, which helps them to get away from their triggers, like, stress for some time. In spite of being aware of the fact that it isn't good for health, if we look on a broader prospect. So can you take us through a way how, if someone wants to quit smoking, can progress ahead with the journey?
For me, what I would say is quitting smoking is more like a journey. Yes, there are people who go cold turkey. There are people who quit in a day, and that is amazing. So I'm going to say, when you decide to quit smoking, or when you actually decide to quit anything or make a change, it's more like a journey. For some of us, it can be a very short journey. You decide one day and then you decide, okay, I don't want to smoke anymore, and you actually can quit. But for some of us, it's a longer journey, and there's no judgment attached to it, right? Some of us find it more difficult to make that change. Maybe our addiction levels are different, but it is more like a journey. Because when we start smoking, right? I would say a lot of people start smoking when they're in college. Could be because they experience some sort of pleasure when they're smoking, or it's just because they want all their friends are smoking, so they would just go along with their friends so that they feel like a part of the group. It was like a cool thing to do back in college, just to hold that cigarette or go out, smoke was just a cool thing to do. And it started off very innocently. It just started off as I'm just trying one cigarette, no harm. But slowly, it actually gets you so addicted that now, even if you want to, you're like trapped now. You're feeling trapped. So even if you want to quit, it becomes difficult because you're so addicted to needing that smoke. And human beings, anyway, when we think of making a change, we find it very difficult. Though change is the only constant thing, I think human beings find it actually very difficult to make a change very easily. So even when you're deciding to quit smoking, it's a change that you're making. So yes, it's going to be a journey, and it is going to be a process for you.
True that.
So when we're looking at making the change, we're looking at two things, right? You ask yourself two little things. I'm not going to just bombard you with information of how to quit smoking, right? Because I think even if you just Google search, you would get that. Coming from like quitting smoking from a more psychological or counseling perspective, when you're trying to make a change, because that's what we all want to do, right? Make a change. There are two things that you have to look at. Where are you currently at, and why are you making this change? What is your intention? Why do you want to make this change? It could be because you have a particular goal that you want to reach. You want to be healthier, or you realize that you're being addicted to this. So why are you making the change? And where are you currently at in your smoking journey? Right? These are two things that you have to consider.
So what do you mean by where you are at exactly over here while making the change, Jennifer?
Take you through a little thing to explain to you. So if you probably know somebody, or right, go that quitting is journey. So we're looking where we are five, you're not relating. You're smoking, you're smoking only 1 or 2 cigarettes. You're not really focused on, or you're not really looking at, I want to change. I want to change this habit. I want to break this habit. You're very comfortable with where you are. So you're not really thinking, I have to change or I have to stop smoking. That's pre-contemplation. The second one, contemplation, is where you're considering, you're considering or you're contemplating making that change. You don't want to be like, okay, you realize that you're smoking too much, it's affecting your health, you actually see it affecting your health, and you're ready to, you're contemplating to make the change, but you're not doing any action for it. Right? You're not taking the action to actually make it. For us to probably just reflect and see, are we in that pre-contemplation stage where, we are not even talking or thinking about quitting, or contemplation stage. The third one is preparation stage. A lot of people who are in this stage would have tried to quit in the past. They would have tried little things to, stop smoking. They would have had their own plan, tried to wean off from smoking. They've tried in the past, but probably failed, or probably didn't really achieve the success, or didn't, meet that goal. So that's preparation, right? That's the third one. The action is more like a step. It's that final jump that you do, and you finally quit smoking. So you have like a streak. I haven't smoked for X number of days. So that's the action that you're taking. So you say, I haven't smoked for 2 months, or I haven't smoked for 2 weeks, but you've taken that final action, or, that step where you're saying, okay, I'm going to stop smoking and make those changes. And the last one, maintenance, is once you've stopped smoking, you're trying to maintain it. You don't want to go back to smoking. So you're actually maintaining that. Now, these are the 5 different stages that you're at. So it'll be nice for us to just simply go through which stage are we possibly at. Now, this is something that counselors do. When we talk to someone who is very dependent on smoking or any form of drug or substance abuse, we look at which stage they might be in. Are they in pre-contemplation, contemplation? Is it a preparation, action, or maintenance? Because once we know where they are, it's easier to make the change. Right? It's easier to make the change. Also, the two questions that I would ask each one to reflect on is this change actually important to you? Do you really want to make the change? Don't make the change because people are talking about it, right? But is this really important? This change important to you? Is it personal? Do you find it meaningful? And are you confident to make this change? Because yes, there are a lot of content, there are apps online, there are videos online, there are talks like this that are organized, right? Which might motivate you to make that change or to stop smoking. But in the end of the day, you're going back to your workplace, which is so stressful, and there is no way around it. You have to meet deadlines. It is stressful, or you've been just addicted to it. Is it possible for you? Are you confident that you can make that change? Now, that's something that you need to work towards. Believing that, yes, I can make that change and this is important to you. When you're able to answer these 2 questions more positively, so from a scale of 1 to 10, say, how do you think you can make the change? Are you on a 1 or are you on a 10? The goal of the counselor is to actually help you reach that 10, right? Even in the second question, how confident are you to make the change? You may not be confident now, but you can slowly build that confidence that, one day I can actually stop smoking. I will, and I can. I think that is the mindset shift that we're looking at. And that's how we work with our clients as well. So that's the different stages, Pooja.
Yeah, true that. So, I can understand now, like where you are at exactly, from where you want to pick up your journey and at what stage you are in. It's very, personalized. It's not very, generalized in that manner, right?
Absolutely. So it's very personal. It's not that everyone's journey is going to be the same. I can't go give you a formula and say this is how everyone can, quit smoking. You have to know where you're at to be able to make that change.
Correct.
That is essential. The next thing that we're looking at is what are we actually trying to change? Yes, on like an umbrella term, I can say, okay, we're all trying to, or, the aim is to quit smoking for somebody else or for ourselves. The aim is to stop smoking. But you need to change a lot more than smoking to actually quit smoking. I think that's the most important thing. People think, okay, I just reduce the number of cigarettes, that's good. That's it. But you have to change a lot more things. For starters, you have to break routine. Right? You have to break routines because our mind is so used to routines You know when exactly you'd want that next cigarette, right? Or you know exactly when you reach out for the next puff. So you have to break routines. If possible, avoid places that you generally go to where you smoke, right? So it could be in your office, it could be during the break time that you actually go out for a smoke. So kind of avoiding those places, creating some sort of distraction in the beginning can actually help you reduce or wean off from smoking. I think that's important. And keeping it simple. If you're smoking, give your body a shock by saying I'm going to do none, right? Because there will be withdrawal symptoms and all of that. So keep it simple, keep it low, but be consistent. That's the most important thing, right? So that's what are we changing?
True that. And
Yes.
why are we making these changes is something which we all should know about specifically. So if you can put some light on how smoking, affects us briefly over here.
Yeah, absolutely. This is something that I think all of us know. Even if you buy that cigarette packet, you will see a picture over there of someone who's suffering from cancer. There is already like you know, on that cigarette cover, if you see behind it, actually says smoking is injuries or smoking is dangerous. You see movies, you see it all over the place. You know, smoking comes with risk factors, right? It's not something that is a healthy practice that we are following. So when you're talking about smoking, I'm sure we all know risk factors to it. But just to simply take you through it, I would say it has physical risk factors. It can cause cancer, stroke, heart diseases, cause chronic lung diseases, gum infection. It could also reduce fertility. And this list can go on, right? It does cause a lot of health conditions and deteriorate your health. But smoking also has psychological risk factors. It's not good for your holistic health as well. When you're looking at psychological risk factors, you're looking at there is a huge connection between stress and smoking. Though you might say, hey, you know what? Actually, I smoke because it helps me reduce stress. But that's not how it works. When you're looking at smoking and psychological risk factors, and this is what we're actually looking at discussing, right? One might say smoking helps me reduce stress. When I'm stressed, that's when I smoke, and smoking helps me calm down. It's important for you to know that when you smoke, there are different chemicals when you're in your cigarettes, right? So when you have this specific chemical called nicotine, it reaches your head very fast. So when you smoke, within 10 seconds, it actually hits your head. And what nicotine does is it kind of masks your stressors. Nicotine in itself is a chemical that increases blood pressure. It increases heartbeat, right? It changes your breathing pattern as why. The first time you smoke, it's not a very pleasant feeling. The first puff, first ever puff, if you see people start coughing or they feel uneasy, they feel little light in their head, what's actually happening is your body rejecting that substance. It's not good for you. So your body is actually rejecting it. But when you continuously do it, your body begins to adapt. Our bodies are wonderfully made, right? So if you treat them to a certain substance, it begins to adapt to that condition or it begins to adapt to that substance. So when you continuously smoke, your body actually adapts to it. And now what happens is your body releases various hormones like endorphins, dopamine, to make you feel better at that time, to mask these changes that are happening, the nicotine changes that are happening. And that way, it seems like, it just looks like it's reducing the stress, but that's not what it is doing, right? It's just taking care of your nicotine withdrawal symptoms. It's kind of making you feel more calm that way, but it's not helping you deal with your actual stress. It's not actually helping you deal with the problem. When you don't take care of stress, right? Or anxiety now anxiety is also a condition. Like you have panic attacks, you have anxiety attacks, right? Again, a person who is smoking, and if they already have anxiety, it could get worse as their withdrawal symptoms. They could actually feel a lot worse, a lot of restlessness that can come in at such times as well. Smoking and depression is also connected. We might think depression is only when you're sad or upset about something, but depression is also caused because of lack of dopamine in the brain, right? Dopamine is a chemical substance. It's simply, just to simply state it, it's something that helps you stay in a positive or a happy mood. right? Now, in your body automatically produces dopamine. When you're smoking actually helps you. Now, this may sound contradicting, but please hear me out. When you smoke, sometimes dopamine increases. So now a person who is depressed will smoke, dopamine increases, they feel good. But their body automatically says, okay, I don't have to produce dopamine on my own. The person needs to smoke for me to produce this chemical, right? And therefore, it's more like a vicious cycle that to feel calm or to feel good, now you need that smoke, because that the addiction is actually bringing so much of changes in your body, right? There has been links in studies with smoking and schizophrenia. Schizophrenia is basically when you begin to hallucinate or when you're having delusions. In simple language, it's basically when you hear things that are actually not in your surrounding or see things that are not actually in your surrounding. And of course, you can hear a lot of sounds and words in your mind. So that's smoking and schizophrenia. But this is in a very diluted form. That's not what schizophrenia is. But there is a huge link between smoking and schizophrenia as well. And smoking and addiction, we've already covered that. Smoking can cause addiction and cause hormonal changes in the body, which is the endorphins, dopamine that I'm talking about, and can also change your brain functioning, the way your brain is working to release all these hormones, right? So smoking has a lot of psychological risk factors, not just physical health. So your overall health is being affected when you smoke. Yeah.
True that. Thanks for the wonderful explanation about all the physiological and as well as psychological risk factors that we should be aware about. So Jennifer, there is, a personalized choice and, personalized, triggers or fears that people get indulged into smoking, right? So can we discuss about them?
Absolutely. So just before we get into discussing that, Pooja, I just want to say that as a psychologist, I am not here to build fear or throw shame and guilt at y'all or anybody else who's smoking, right? That's not the best way to help someone come out of that smoking habit. There is no point of actually feeding people with fear. A lot of advertisements, they actually show pictures and fill you with fear, assuming that you would stop smoking. But psychologically, we've actually seen that feeding fear to somebody else is not going to help them at all. So I'm not here to feed you with guilt, shame, or fear to stop smoking. I'm going to encourage you to get information as much as you can, and as an adult, make an informed decision about it. I'm not even deciding for you, right? I think it's more about making that informed decision once you have all that you need. And again, when we look at smoking, I would want to just pause before we get into answering Pooja's question. Pooja, is that okay?
Yeah, definitely. I would love to interact with the people who have joined us, and I can see already we have, received so many questions that we'll be taking it at the end of webinar. So everybody, the floor is open for you. We can actually listen to your problems and your trigger points so that we can help you out with that.
To leave everyone with a question, what do you actually like about smoking? Or why do you think people smoke? So if it's not you who smoke, maybe somebody else. But if you ever ask them, why do you smoke? What are their answers that you get? Please begin to just put that out in the chat box. You could even unmute an answer if you would like. Which are we getting answers?
Yes, we are. So diversion from a usual life are high, and social connections because they want to relax, momentary pressure, Abhay is saying that he smokes when he is outside his hometown, but as soon as he leaves it and comes to office, he starts smoking.
Right, you can't smoke at home.
And pleasure in brain is another answer. Just for fun is another answer for you. Distracting from anxiety, stress release, to get along with peers. In nervous system, it's a different feeling.
Absolutely. Thank you so much. I think like you said, there are so many things. If you ask someone, why you smoke or why do you actually drink or smoke, they have various answers. And just going to share with you a few of them. Right over here, if you look at this, some of the answers I think that they've already shared with us on the chat, right? It helps you relax. People actually say that, when they tend to smoke when they are feeling stressed. They've had a hectic day, then they want to smoke because it helps them relax. It helps you deal with stressful situations better. When they're going through something, it helps you deal with that stressful situation better. I've even heard people say it helps me focus and concentrate better. When I don't smoke, I begin to feel restless, and smoking actually helps me concentrate on a task. It's a good break at work. Of course it is, because at work, you're working continuously on that laptop. But when a smoke break is allowed, right? There are smoke zones as well in the office. You go there, you talk to colleagues. It's a great time to interact, great time to talk to them. Of course, it's a good reason to step out of work and go for chai and a smoke as well. So it's a good break. You socialize with people, you get to talk to people. Nice conversations that come up while you're smoking. It's a nice thing. I mean, of course, there are a lot of things that can seem like, hey, this is actually good. It's actually helping me. Networking with colleagues, talking to them. Probably you're smoking with your boss, and then that's great networking for you. You're networking with other people. You're brainstorming ideas for a new startup. I think all of that is actually happening. And also focus, concentrations, all of this. I think you all have also shared such similar things. Also just dealing with things that are happening at home, all of that, multiple reasons. We can have enough and more reasons, but they're all just perceived positives of smoking, right? They're perceived positives. I'm not negating. Yes, when you smoke, it does feel like it's helping you calm down. Or when you smoke, you do feel happier, right? And that's exactly what that little cigarette has. It has the ability. You feel like, hey, this is actually helping me a lot more. It is calming me down. It is helping me deal with my emotions better. I'm stressed, I smoke. I'm sad, I smoke. What's actually happening? Why is smoking so addictive? Right? Why are people actually reaching out and smoking? This is just a little bit of understanding of how the cigarettes works. Nicotine as a chemical substance, I already mentioned this, it reaches the head within 10 seconds. It reaches the brain within 10 seconds. And it alters your mood. It actually helps you, or it kind of covers up. It makes you feel like, you're in a better mood. You're able to concentrate. Initially, it feels like it helps you reduce stress. It helps you relax. It also doesn't make you feel too hungry, right? It's doing a lot of good things, but these are very temporary, benefits that you're seeing, because what's actually happening, it's not nicotine that's doing this. Nicotine is actually causing a lot of harm. To mask this harm, your body is trying to cope with it, right? But now your body suddenly feels like, hey, I need that nicotine. I need that cigarette to even feel good, to release those hormones, which can be naturally produced in the body, right? But now you feel like, now that's when you have nicotine addiction. And when you're withdrawing from nicotine, it's not a pleasant journey, because your body will ask you for, the cigarette, because you suddenly start feeling very hungry. You start feeling restless. You can have headaches. Again, withdrawal symptoms of nicotine are something that you have to take care of if you're deciding to quit or stop smoking, right? Because it's not, again, a very easy process for everybody. So yes, nicotine also changes the way your brain functions, and this could lead to a lot of symptoms. And we're essentially looking at the addiction that it develops, and therefore causing a lot of difficulty in the body, and that therefore it causes more addiction in the body. So yes, so as much as I would agree to like these perceived positives, and I would agree to even clients of mine who would probably say, these are things that it helps me with, I would say, can we look at something else, an effective way where you have the power, right? Where you take back the power. It's not in that cigarette to make you feel good or make you feel calm, but where you're able to take back the power. And I agree. It's not just easy to say, oh, okay, I take back the power. I'm not going to smoke when I'm stressed, but I'm going to do something else. To know what else to do, that's when you need help, right? That's when you actually see a therapist, or you talk to a friend, anybody. But find something alternate that you can actually do to help you reduce this, other problems that you're dealing with, and other withdrawal symptoms that you're dealing with. But I think being aware of what it is the first part of the journey. Right. So I think that's why smoking is addictive.
Definitely.
Yes.
So how do we understand, and classify if someone is an addict or not?
Right. One, I think you would know, but if you have to like identify if a person is smoking, is mainly small questions that we ask yourself, which is, do you smoke more than 15 cigarettes per day? Right? Or do you smoke immediately after you're waking up 30 minutes after that you want to smoke? Right? You feel like the first thing that you want to do in the morning is smoke. Or you can't go 4 hours without smoking. And these are signs. Again, 4 hours or less, right? These are signs that you're actually addicted to nicotine. And you need that dose of nicotine for your regular functioning. And you're addicted, or you're getting addicted to cigarettes, or someone close to you is getting addicted to cigarettes when it is affecting their day-to-day functioning. Again, so when you start off with smoking, it's sometimes only 1 or 2 cigarettes. It's easier to wean it off that time. But once a person is extremely addicted, it can take more time, of course. But it is, these are some of the things that we look for. How many cigarettes do they smoke? What are the time gap between, when they are smoking, and how many hours, like after they wake up, how often do they need to smoke? These are a few things that could actually give us an idea about if they're addicted or not. All right.
And now we want to know that how do we make this change over here? Because, how can we have already learned about the risk factors and the classification if someone is an addict or not. But what are the methods and, points that we can, remember to figure out what are the triggering points for them specifically?
Again, we're coming to actually making the change. Right? When you're deciding that, okay, I want to stop, what are things that you have to consider? Right? Over here, you have to prepare for it. You have to have like a plan of approaching this. You can't just say, okay, I'm going to quit, because like you will feel tempted to go back, and not just tempted, your body would ask for it, right? So here, just identifying what your triggers are. I think that's the most important thing. And I'm sure we already know this, but just to go over this, it could be just your coffee break, it could be sex, it could be meals. After meals, you want to probably go out to smoke. It could be a break time at work. When you get like little breaks, it can be a phone call. It could be when you're driving, when you're in traffic. It could be with specific social groups, with certain group of friends. You meet them, everyone's smoking, so why not? I will also smoke. So what are your triggers? Just identify those triggers. I think that's the first and most important thing. The second one is to see what's happening in your mind. Now, I've listed out a few things, right? These are fears that one can have. When we say, oh, you know what, when they decide, I want to stop smoking, automatically your head thinks of fears or ways to resist it, because our mind is built like that. It's not easy to change, right? Our mind automatically builds resistance. So you probably look at what are the fears that, they could have. Some people would feel like, hey, you know what, smoking is actually going to help me relax, like we've already discussed this. So they feel like they need to smoke. They could also feel like I have a lot of triggers. All these things on the left hand side, all of them. I have all of them. So I already have so many triggers around me. I can't stop. There are people who even say, I need something in my hand. I constantly want to fiddle with something. I want to move something. So, that's their other need that they could have. They're also scared that they might gain weight, right? Because smoking and nicotine actually does, you don't feel very hungry. And over here, one of the withdrawals can be hunger that you can feel, right? Increase in appetite. Again, so smoking could actually, that's a fear that people have, if I stop smoking, I might gain weight, I might put on a lot of weight. But yes, you might feel a lot more hungry, but probably choosing to eat healthier food is another alternative than going to junk food, right? So you might have that cravings to eat a lot more. But just reframing your fears, or rephrasing your fears, looking at your fears very differently. These are true. You might gain weight, but it's not that excess weight that you're going to put on. It's going to be an average of 2 kgs. That's it. Like based on studies, they say that it's not like a lot, and you're not going to just bloat up. If you're eating healthy, if you can choose to eat healthy, you can choose to do another activity or exercise. Being physically fit is another very important thing to help you reduce weight or to to, reach your optimum weight. So these are a few triggers that you need to kind of prepare for so that you could plan for your journey to stop smoking, right? These are a few things of such as skills that you might require and some behavioral changes that you could make. Now over here, I'm going to list out a few. Again, this, I'm not saying it's, you have to try out everything. You could choose one that you think works with you and works for you, and then go with that method. The first one is willpower. And oh my God, haven't we heard this word all over? Somehow it's like a word where I would say, I'm not just going to say it's that positive motivation kind of thing, right? Because if you talk to or ask someone what is willpower, they're going to say, you know what, if someone fails in something that they do, they don't have willpower. If they've decided to do something, they fail in it, they don't have willpower. If they succeed in what they wanted to do, they have willpower. But I'm saying willpower is a little more than that. It's that ability to say that I'm going to try, you decide on something, even if you fail, to restart that journey. That's willpower, because it is a process. It's not a linear thing that, once I decide to stop, it's going to be that way. Also being patient to people, your loved ones who have decided to stop smoking, but if they fall back, but just continuously being supportive is the key over here, right? Even being supportive to yourself. So if you failed, if you feel like, I tried stopping so many times, but just to restart again, I think that's the most important thing. According to the study, there are people who have gone cold turkey, right? Cold turkey is when you just decide, I've been smoking for so many years or days, but I'm going to now, from today onwards, I'm going to stop. I'm going to stop smoking. And from the next day, they actually stop. Research has shown that there is a small percent of the population who have been successful in this technique. Some people, because they have withdrawal symptoms, they get back to smoking, right? So again, cold turkey may not be for everyone. Looking at your risk factor, looking at health conditions, I would say, please make sure you're aware of which technique you're going to use if you're deciding to stop smoking, right? So one is willpower. Second one is medication. This is prescribed by doctors. It is important for you to visit a doctor based on your health condition. If you're diabetic, if you have cardiovascular diseases, if you have, say, any form of illness, if you're pregnant or you have cancer, based on your health condition, they would actually give you medications to help you reduce smoking. So that's also a good option for you to consider over here, right? The next one is nicotine replacement therapy. And I think a lot of us have heard about nicotine replacement therapy. This is basically where, because in the end of the day, when you smoke, you're actually addicted to the nicotine, right? So nicotine replacement therapy is giving you small doses of nicotine, which is measured, safe, small doses of nicotine. But remember, in the end of the day, it is still nicotine, but it's still good. It's small doses, controlled doses, and especially if you're addicted to it, you have different ways in which you can use these nicotine replacement therapies to help you. Different things like you have a patch, which is like a small patch that you could have. You could place it on your arm. This is for a regular and continuous nicotine supply to the body. Right? So you have a patch. You have nicotine gums that you could chew on. So you keep it between your teeth and your gum, and you actually feel, so that's again constant nicotine supply to the brain. You also have lozenges, which is like a hard candy that you could put into your mouth and it melts. You have inhalers, you have nasal sprays. There are different types of nicotine replacement tools that you could use to actually give you the nicotine that your body needs. What is the good thing about it? It does not have all the other chemicals like the tobacco, the carbon monoxide, or the tar that's actually there in the cigarette. All the other harmful chemicals are not there. Just the right amount or slight amount of nicotine which is there for your body, so that you don't have that much of withdrawal symptoms. But I would say you need to combine some behavioral techniques as well with nicotine replacement therapy, right? So just don't go with nicotine replacement therapies alone, but if you combine it with, say, a behavioral strategy or behavioral therapy, it's going to help you a lot more, right? That's nicotine replacement therapy. Some people ask, you know what, would I get addicted to these patches? Would I get addicted to having these nicotine gums? Yes, nicotine is again a harmful chemical, but because it's in slight amount of dose, of course, it can have prolonged use, can affect your health. I'm not going to say it's not, and I'm not going to say just replace this with this, it's going to be fine. I think for the beginning process, of course, using this as a replacement can be done, but receiving help or getting help from a health practitioner would actually help you sustain and stop using nicotine replacement therapy as well, right? I think that's what we're looking at. Sometimes questions that are asked is, are these nicotine replacement therapies expensive? You get these patches for about, just on an average, I don't know the exact price, but I could give you an average of maybe they're 700 rupees and these nicotine patches, and the gums are for like 82 rupees, the nicotine gums. And I'm giving you an average. I'm not being very specific, but you could, of course, find them on Amazon. You can buy these nicotine replacement patches even from medical stores, and they can help you. But this is not for everyone. I would suggest also checking and making sure your health is supporting, or you can actually have this. So it's best for you to consult with a doctor here. You have some behavioral interventions that you can do, which is using different behavioral strategies. This is something where a counselor steps in. You could also work with a counselor to have behavioral strategies like use CBT techniques, which is nothing but cognitive behavior therapy, where we help you identify why you need smoking so much, or why do you need that cigarette, right? Just using your ability, reasoning ability over here. I'm diluting what CBT is, but CBT is a form of therapy that helps you make the changes that you desire. Also using support groups are very, very helpful. Token economy, if you all have heard, it's about, you deciding that you wouldn't smoke and probably putting some amount of money aside on the days that you don't smoke, right? As a reward for yourself, that you could do something with that money a little later. So these are different behavioral strategies that can work. There have been cases where people say acupuncture, laser treatment, hypnotherapy also works. If any of you, I'm going to, probably quote a little bit of, if you've seen Friends, you've seen Chandler trying to use hypnotherapy. He uses a tape to help himself stop smoking. And yes, but different therapies do work. And of course, if you have someone who could guide you with that properly, and if you have a therapist who would take you through hypnotherapy, then that'll be great, right? But there are different ways to stop smoking. So it's not that, oh, you just have to go cold turkey. There are different ways that you could slowly wean off from smoking. I think these are skills that are required to make these changes.
Thank you, Jennifer, for such an extensive explanation about, what are all the ways that we can, seek help from. And now I would like to know, do we get any kind of withdrawal symptoms while getting on these treatment therapies?
When you stop smoking, yes, you will certainly have some withdrawal symptoms. And like I said in the beginning, it's not a linear journey. It has its ups and downs. Some of the withdrawal symptoms that you could have, again, depending on the person, you need not have everything, are headaches, nervousness, where you start feeling restless. Your body starts needing the cigarettes. You feel irritated very fast, trouble sleeping. Your hunger increases, another withdrawal symptoms. You also begin coughing because your lungs are actually trying to clear out the tar and all the dirt. It's trying to actually clear out because it actually doesn't need all of that, right? So it's trying to clear out. So you begin to cough when you're also on your journey to quit smoking. So these are some of the things that are more like withdrawal symptoms for a person. But of course, you don't have to feel like, if you decide to quit and you feel like you're on that down phase where you went back to it, I would say don't feel helpless and go like, oh, this is never going to work with me. I don't think I can ever quit smoking. Don't learn helplessness, but actually try again. Begin again, try again in that process. I think that's the most important thing. So yeah, quitting isn't easy. I'm not going to say that it is easy, but it's completely worth it because it is you taking care of yourself. So it's again a choice that I would love for everyone to consider.
Definitely. And I believe, this journey is, just not possible without any guidance, or you can say a mentor who can guide you along, because this is a very personalized approach and you might, require help in this. So Good Health Clinic is here to provide you tech-powered decision health through personalized and science-led mind and health coaching. We work over the root cause with a multifactorial approach to deliver the best outcomes to your health outcomes. So our approaches are based on latest evidence-based science and which are, safely carried by international experts in the field of nutrition, medical and mental health. So each and every individual is unique, and we truly believe that, personalized health coaching is the best way that will help you achieve your health goal at your own pace through a seamless mobile experience. So we are launching our next batch of cohorts for the Healthy Living program in next week. And for past care members and their families, we are offering this program at just rupees 1,999. So don't miss this opportunity and enroll yourself and your family members if they are looking for a healthy, change in their lives. Also, I am sharing a feedback form with you all, which has already been shared once. So please fill this feedback form for us, because we all have put a lot of effort to organize this webinar, and we will love to hear your experience about it. And I think, Jennifer, we can take the questions, right?
Absolutely. Yeah.
Perfect. So everyone, the floor is open for you. You can ask your questions. I'll start with the question. So Sunil is saying that I'm not smoking and drinking last few months. I have right side head pain. I consulted doctors also, but not get relief with medicine, both allopathic and homeopathy. What should I do to get relief? This pain forced me to start smoking or drinking again.
If I've understood his question, he's saying he's quit smoking a year back.
Few months back.
Few months back, and what is the pain?
He's having pain in a right side over the head.
I think if it is physiological, which is if he's actually having pain in the head and he's experiencing the pain, what I would suggest is for him to see a doctor, probably get the scans that he needs to do. But this is something to do with physical health, right? So again, it'll only be right for a doctor to take a look at the condition and probably then decide what needs to be done for action. I know he said he's tried allopathy and homeopathy, but I would say getting the right kind of help is what is important. But not being so, tempted to go back to smoking, because that's certainly not going to help. It's not going to relieve your pain, at least. What doctors would do is probably take scans to give different types of medication to identify the reason for the pain. But smoking is certainly, for sure that is not going to help you relieve that pain, because it's not a painkiller that, smoking is. Yeah. So that's not going to help.
Yeah. So Nishant is asking, how do we handle secondhand smoke? People are always smoking around us.
Right. Passive smoking.
Yeah.
Right. I think this is a real concern, because there's so many people smoking around us, and it's right there. You can even be in a social group where you decide not to smoke, but people around you are smoking. And this is a real concern. Passive smoking is also injurious to health. That is why people have actually segregated office space. So even in restaurants, you have a smoking and no smoking zone. Try and stay. There is only limited things that we can do, right? As a collective, if we can be more mindful about where we smoke, in which environment we smoke, I think that's the best thing that we can do. Choose to move aside and smoke. Be mindful if there is someone who does not like the smell. Probably just check with them before. I would suggest staying away. Smoking in the specific smoking zones would actually help. But probably just changing our environment is what we can do. If we are the ones passive smoking, but there's nothing else we can do. We can't force somebody else to make the change or stop smoking. Just moving away from that environment is the best that we could do. Or ask people to be mindful about the fact that you don't want to smoke. And that is something that we can do. But otherwise, it's a collective thing that making the environment cleaner and all of that is more like an environment thing.
Okay. And what should we tell teens about the impact of smoking? They do not want to, understand the obvious. Any specific ways to educate the teens around us?
I think having worked with adolescents, one is you have to realize that adolescents want to rebel against what is told to them, right? When you tell them don't do something, they have this need of like, I want to do it. I want to try it. So they have that need. One, it's because smoking seems like the cool thing to do in college. I think we need to remove that. Smoking should not be the cool thing to do, right? I think just that outlook of, oh, I'm smoking, so I'm cool. And teenagers want to be cool. They want to be in that zone. So I think that's why they get into that addiction. And of course, smoking in itself is an addiction. So very early on, they start. Um, I think the best thing that we can do for adolescents and teens are to educate them. Because when you force someone, anybody, not just teens, I think even adults, if someone tells me, you know what, you can't do that, I'd be more adamant to do that. And all the more with teenagers. Educating them is the first thing that you can do. Educating them, giving them the choice to say, you know what, you decide, teaching them how it's going to affect their health. And of course, they're not going to think long term. Teenagers are not going to think long term, oh, this can cause cancer to me. They feel like, oh, you know, today I'm fine. Today it's pleasure, it's fun. So they might, of course, think that way, but giving them that chance to educate them, telling them these are the effects that it can have on even a short-term basis. So for them, it's more not long-term basis, but how it's affecting them at the present moment is what you need to be, doing with teenagers.
True that. I hope you have got your answer, and you have to, educate teens about it, and, let them know what are their, health impact in a longer run, and how it can, affect their health. So I think that would be really helpful. Someone is saying that I have the habit of smoking only along with the drinks. How can I overcome that? By what ways I can avoid smoking with drinks?
Right. There are some people who prefer smoking only while they're drinking. So clearly your trigger is the drink, that, when you're drinking in that situation, that's when you feel like you want to smoke. I would say try weaning off one. I know what's happening is in the mind, it's conditioned. It's simple classic case of classical conditioning, if I had to throw some psychology and jargons here. But it's basically you've paired these two things together. When I have my drink, my urge to smoke also comes into play. Right? If you all heard of that Pavlov's dog experiment, the dog sees the food and begins to salivate even before actually trying the food. It's like that. It's conditioned. Our mind is conditioned that when that drink comes in, I need to smoke. But just kind of deconditioning or unconditioning is important, where you can probably start off with not having that many smokes. So probably weaning off the smoke and slowly getting off smoking and drinking if possible. Just doing something that is healthy for you. But otherwise, if you're just talking about smoking, then probably just weaning it off slowly and deconditioning your mind would be the best thing that we could do here.
Okay. Yeah. And can you suggest what we can do when we are facing trouble in sleeping when we start quitting smoking?
Absolutely. I think in that withdrawal symptoms, I forgot to mention that sleeping can, nicotine and withdrawal symptoms is one thing that affects is you can't sleep, right? You feel restless and you actually can't put yourself to sleep. You have constant thoughts, you feel irritated. There are some exercise that have been suggested for it. Like in yoga, if you look at, they have suggested some exercises to help you sleep better. Again, medications can help you over here to sleep better. Therapy can also help you here, because if it's insomnia or difficulty in going back to sleep, insomnia, anything of that sort, then certainly therapy can help you sleep better. Just a few sessions can actually help you. You'd see difference in the way your sleep patterns also change. But just remembering that it is a part, your body is retaliating to what it used to get before. Withdrawal symptoms are a part of this journey. It is going to happen. The only thing is for you to manage these withdrawal symptoms. I mean, it is going to happen, bound to happen. You're going to have some withdrawal symptoms. So you can't have that journey without these withdrawal symptoms. It's just to be able to deal and manage these withdrawal symptoms. That's what we're looking at. So maybe reaching out for help, I think, Pooja, that would be the best way to deal with that. Doing exercises if they can on their own, probably working out, some physical form of activity. If those things don't help, then certainly meeting a doctor or a counselor would help.
Definitely. So someone is asking that, I have this routine where I smoke 5 to 6 cigarettes every night. And I say this to myself that, this is my last cigarette and I will not smoke from tomorrow. But again, next morning, one weak moment comes in and it all goes to toss. How to manage that?
So again, this is also something that does happen, and you decide you're smoking, and you're like, okay, this is my last cigarette that I'm going to smoke. You're very motivated, and you go to sleep. You're feeling relaxed. You're feeling positive because, of course, you've just smoked. But the next day, you are going to have multiple triggers. It could just be a dip in the mood, or something that you didn't like, right? And you might just go back all the way there. One thing that you can do, it's a suggestion that I'm making, but of course, if we can understand what your triggers are, we could deal with it better. But just a suggestion is to probably keep your cigarettes nowhere close to you, which is, if you have cigarettes, probably to trash it, throw it away. At night, if you're smoking, that probably means that you have cigarettes in your house at like arm distance. You could reach out for it, or it's right in your cupboard or somewhere where you could just reach out for it and smoke, right? So probably just not having cigarettes at home or wherever you're sleeping, making sure you're clearing out your space is very important. Again, just clearing your space, making sure there's no lighters, there's no cigarettes, and you will have to do something, like you have to probably get up and go out to actually get that smoke. You're not going to be motivated to do that, right? So it's going to be more of a task to do. So probably just clearing out your environment would be one basic thing that I could suggest for you.
Definitely. So we have to actually figure out what are our triggers, and if we can, stay away from them, I think that will really help.
Staying away from cigarettes, yeah.
Yeah, correct. So I'm sharing feedback form link again with you all. It's a request that please fill this form so that we can make improvisations and make your experience better with the next webinars. And also, if you have any questions related to health or any queries, you can directly reach out to us. And thank you everyone for being here for the talk. I hope you've enjoyed the session.
Thank you so much, everyone.
Thanks, Pooja. Thanks, Jennifer. Thanks a lot, everyone, for being a part of this session. If you guys really like the session, the overall presentation and everything, do give Past Care and the Good Health Clinic a shout out on LinkedIn or on Twitter. You can tag us. We would love to see it on LinkedIn or on Twitter. So yeah, looking forward to your feedback. I think we also have shared one emailer with you. It will land up in your email box soon. Do share your feedback. Do give us a shout out on LinkedIn or on Twitter. Looking forward to it. Thanks a lot, everyone. Thank you so much for joining in. Have a great day. Bye bye.
Thank you, Anshik. Thank you, Jennifer.
Thank you so much.